In this video, we're going to talk about sudden infant death syndrome, also known as SIDS, and 5 things you can do as a parent or guardian to reduce the risk for SIDS. So SIDS is a common cause of death among infants, accounting for about 38.4 deaths per 100,000 live births in 2020 alone. This is the unexplained death of a baby between 0 to 12 months, which is sometimes referred to as crib death, as the baby often passes away in their crib. So the actual cause is unknown, but it is thought to result from problems with the area of a baby's brain that controls breathing and waking up, or environmental factors. So positioning a baby on their back during sleep is arguably the best research-proven practice to reduce the risk for SIDS. In fact, a campaign launched in 1994 in the United States encouraging parents to have their babies sleep on their back resulted in over 50% decline in SIDS incidents in the country. So basically, having the infant lie on their back reduces the risk of obstructing their airflow, which is highly possible if placed in a side lying or stomach lying position. Another very important practice is to keep the crib as bare as possible. Avoid placing pillows, toys, stuffed animals in the crib, as they may potentially affect the infant's breathing if they do ever press against their face. Now, number 3 is to avoid the use of a blanket, especially not to cover the infant's face. To keep the baby warm, instead of using a blanket, you may try sleep slacks or dress them in layers. Now, number 4 is very important, and that is to have the baby sleep in your room but not in the same bed. There is a very high risk of the baby being suffocated by their parent if they do sleep in the same bed. Therefore, it's recommended to have the baby sleep in the same room but alone in their own crib. And lastly, you may offer a pacifier at nap time, which may reduce the risk for SIDS. If this video was helpful, don't forget to leave a like and follow for similar health-related videos.